The Q team, the Q kit started off, we were asked by Brighton and Hove City Council to do a project supporting several homes in the city to develop their residents' meetings. And so we employed 3 of our service users with learning disabilities to be part of that project. And we went out and we started supporting people, visiting their resident meetings, giving them feedback. And then we'd go to a cafe afterwards and we'd talk about what we saw. And then there was these kind of conversations we were having where other stuff was coming up that people had noticed in the homes that was nothing to do with resident meetings, but was really important stuff that they were noticing. So we thought, let's do something about this and let's develop it. So we had this working title for a project that we pitched to the City Council, which we just called Stop Whispering, Start Shouting. Some of the more astute of you in the audience wouldn't recognise that's a Radiohead song. So, quality is different for all of us. It's a personal thing, quality. So it's personal to all of us. So when we wanted to develop the Q kit, we wanted to go round and ask people, what does quality mean to you? So we started with a very big piece of very blank paper, and we just went out to loads of people with learning disabilities, and we said, what makes good support and what makes a good life? So we turned all of those things into the Q kit. So, this was a nice production as well, because I was able to combine both my interests of working for Southdown Housing and also helping to run Stay Up Late, because a lot of the core values of what the Q kit's about is about living the life that you want, exactly the stuff we're preaching at Stay Up Late. So, when we talked to people, we went out and said, what is important to you? They came up with 8 areas that they said were of real importance. And I think you'll probably think, hang on, there's 9 up there. Well, there was 8 that came out of the interviews. Where I live, my support, being me, social lives and relationships, being listened to, food, feeling safe, and new experiences and dreams. But I knew that our local commissioner was really into health at the time, so we included something about access to healthcare, not checking healthcare, but and it was interesting because people didn't really have a view. If you don't like your GP, well, if you're like me, you just put up with it. She's really miserable, but I'm just used to that. But I do have a right to choose her, to change her if I want. So that's what we came up with, those areas. And crucially, the Q kit doesn't have any checklists in it about what quality is. As I said, it's all about questions. So there's 2 parts. There's a workbook, which has got all of the questions in, and then there's a guidebook, which is about how to use it. And in the workbook, there's questions that can be asked directly of people in their support settings, but there's also questions for families and advocates and friends and other carers as well. So everybody can be involved in talking about their service. And I always say, I have never ever met anyone yet who can't tell you how they want to be supported. Sometimes it takes a bit of time and effort to work that out. But that is kind of a core belief of the way that we use the Q team. And there's also things about how to train up a Q team as well. And there's the DVD with the short interviews on, so that when people are being asked questions, they could watch the DVD and get a bit of inspiration about what other people are saying.